Oof.
Good. Right. Down and let it go. Wow. What brings you in?
I've had some like neck issues as far as it giving me headaches. I know I'm really tense on the right side, so my neck has been really hurting, and I've been feeling like I need to pop it, and I'm trying not to.
Yeah.
But I definitely just really tense, from the middle of the back and then in the neck.
Got it. So the right is worse than the left, though.
Yes.
And it brings headaches up to the head.
Yeah, absolutely. Right up the back of the neck.
Back of the neck.
Into the base.
Okay. Does it work all the way up over
Sometimes
the eyes?
Sometimes it does. Yeah.
Okay.
It's
in
more like
temple?
in this area. Yeah.
Right in the temple. Does it affect your breathing? Like you take a deep breath, do you feel stuffed up?
Not stuffed up. Sometimes the headache can get a little worse. It's pressure, not necessarily sinus though. Just the pain might get a little worse, and then I let the breath out, and maybe it relieves a little bit.
I understand. Mind if I take a look?
No.
Okay, stay right here.
Okay.
Let's take a look at the range of motion of your neck first of all. So
Okay.
I'm gonna have you turn your head to the right. Let me know if you feel any pain or pressure or...
A little bit on the right side, kind of in that same muscle area that's tense.
Got it. Let's go the other direction, right here. How's that?
Yeah, no, I'm not getting the same.
Not pulling at all. Got it. Go ahead and look straight ahead. Okay, good movement there. Where does it hurt more? There or there?
Oh, that's hard to say. Not so much there.
Okay.
So high.
How about, yeah, anterior, right there.
Yeah.
So it's actually rotated anterior.
Okay.
Yeah, that's gonna jam up right by the eustachian tube. That's gonna put a lot of pressure on the brain stem and cause headaches. That is Headache Town, USA. So, let's have you go face down. Let's go ahead and get to work, shall we? There we go. So, Tennessee, huh?
Yeah.
Was there a backstory there that I don't know about?
I lived in Memphis for a year.
What?
Back in 2010.
Yeah. You've been holding out on me that whole time, huh? Okay. So a lot of pressure built up stemming, T4. Okay. And then I'm gonna follow the levator scap all the way to the suboccipitals there. So we're gonna get a decompressive lift out of that area. You're gonna like that. Okay, so take a deep breath in and let it go. Good. Nice. That was a big one. I felt all the way through the facet joint on that one. Okay, let's breathe into that. Lovely. Let's do that one more time. There we go. Okay, you doing all right?
Yeah, great.
Let's go ahead and go face up. So far, so good.
Yep. You need me to scoot up, or you good?
No, you are perfect.
Okay.
Don't change a thing. So it's really moved anterior. In fact, I'm gonna have you drop your legs down. Good. And let your neck relax into my hands right there. Good.
Oof.
Nice. That should open up the occiput away from the atlas. There you go. And then to open up the other side, we're gonna drag that atlas back. Good. And I'm gonna clip onto the suboccipital with my index finger and grab the other end of it in your upper back. And that might be kind of one of those hurt so good type of tractions. You handle that okay?
Yes.
All right. How'd that lift feel?
Really good. It didn't hurt as much as, it might have sounded like it would, and it felt good.
Cool. Take a deep breath in right there. Awesome. That was pretty powerful. So let's just relax. Try to allow the body to receive that. How are you feeling overall right now?
Good, good.
Good? Okay. Any soreness at all from the adjustment?
Just a little bit, but it's more like after you get a massage because of the pressure you were putting on, but that's it.
Right, yeah, okay. Go ahead and sit up. Any lightheadedness?
No.
Oh, cool. Okay. Awesome. We're going to open this up a little bit more and get you breathing better, okay? Interlace your fingers behind your neck. Good. And let those shoulders drop down and let it go. Wow. Okay, now we're cooking. Now we're cooking. Okay, we're going to use the arthro stem just to balance out those 3 points we just adjusted, especially the upper cervical spine right there. Push your head up. Bring your chest up a little higher. Sit up a little taller. Those are the 3 spots. You should relax those shoulders. The body's engaged, but it's at ease. Okay, one more big deep breath. Let's see if make sure the smile's still working.
Yeah.
Okay.
I actually feel really relaxed.
Awesome.
So.
Go ahead and turn your head as far as you can this way and back to center. And now look back as far as you can. Okay, back to center. Okay, nice and relaxed.
Yeah.
Ready
And
to take on the day?
when I did the head to the right again, it almost like it didn't pull at all. So that was cool. It was really neat.
It's like this stuff really works, huh?
It does. Yeah. I feel much more relaxed now. I can really feel it in my back, just kind of like.
Awesome.
Yeah.
Now, time to go to sleep.
I got errands to run.
Okay.
But I'm going to be much happier doing it.
Yeah, well adjusted.
Yeah.
All right.
Thank you so much. I always appreciate it.
My pleasure.